Beclomethasone Dipropionate Hfa Aerosol inhaler is used to treat seasonal and year-round allergy symptoms such as stuffy/runny nose, itching, and sneezing. It may also reduce other symptoms of seasonal allergies such as red, itchy, and watery eyes. This medication belongs to a class of drugs known as corticosteroids, and it works by reducing swelling, inflammation, in the nasal passages. It is important to use this medication as directed by your doctor. The usual dosage is 1 to 2 sprays in each nostril once or twice a day. The best time to take this medication is in the morning and evening, but it is important to follow your doctor's instructions for the best timing for your specific condition. Before using the Beclomethasone Dipropionate Hfa Aerosol inhaler, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor. Use this medication in the nose as directed by your doctor, usually once a day. Do not spray in your eyes or mouth. If a child is using this medication, a parent or other responsible adult should supervise and help the child use this medication properly. Gently blow your nose before using this drug. Follow the instructions on how to properly prime the inhaler if you are using it for the first time or if you have not used it for more than 7 days in a row. The dosage is based on your age, medical condition, and response to treatment. Do not increase your dose or use it more often than directed since this may increase the risk of side effects. This medication does not work right away. Some people will feel this medication working within several days, but it may take up to 2 weeks before you get the full benefit of this drug. Ask your doctor or pharmacist if you should also use other allergy medications along with this drug until it takes full effect. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same time each day. Wipe the inhaler regularly with a clean, dry tissue or cloth. Do not take the inhaler apart. Do not wash or put any part of the inhaler in water. Keep track of the number of sprays used from the container. Discard the container after you have used the number of sprays specified on the manufacturer's package. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of Beclomethasone Dipropionate Hfa Aerosol inhaler may include mild nosebleeds, nasal dryness/irritation, or an unpleasant taste/smell. If these effects persist or worsen, it's important to inform your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks. Many individuals who use this medication do not experience severe side effects. However, it's crucial to notify your doctor immediately if you experience any serious side effects, such as pain/sores in the nose, loss of taste or smell, signs of infection, unusual tiredness, weight loss, swelling, increased thirst/urination, vision problems, or any signs of a serious allergic reaction. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. And as always, if you have any concerns or questions about the side effects of this medication, don't hesitate to reach out to your healthcare provider. Before using this medication, it's important to discuss any allergies you may have with your doctor or pharmacist. It's also important to talk about your medical history, including any recent nose or eye problems, infections, and any exposure to contagious illnesses. It's advisable to avoid close contact with anyone who has a contagious infection, and to inform your doctor if you have been exposed to any infections. Additionally, it's important to let your doctor or dentist know if you are using or have used this medication before any surgery or emergency treatment. For children using this medication for a long time, it's recommended to have regular checkups to monitor their growth. During pregnancy, the use of this medication should be discussed with a doctor, and it's important to consult a doctor before breastfeeding while using this medication. It's important to be aware of how Beclomethasone Dipropionate Hfa Aerosol inhaler may interact with other medications you are taking. This could affect how well your medications work or increase your risk of experiencing serious side effects. Make sure to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as any herbal products, and share this list with your doctor and pharmacist. It's crucial that you do not start, stop, or change the dosage of any medicines without first consulting with your doctor. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical assistance. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for help. It's important not to share this medication with others. If you use this medication for an extended period, your doctor may recommend lab or medical tests, such as nose exams or height measurements for children. It's important to attend all medical and lab appointments. Consult your doctor for more details. You should also ask your doctor about ways to reduce your exposure to substances like pollen, pet dander, dust mites, mold, and smoke, which can worsen allergy symptoms. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, then skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When using the Beclomethasone Dipropionate Hfa Aerosol inhaler, it's important to store it with the cap on at room temperature, away from heat or open flame. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.